We're chatting today with Bob Priddy, founder and president of American World Clinics. Hi Bob, thanks for taking time out to chat with us today.
Hello, thanks. It's a pleasure to be here.
Bob, you've got quite a diverse background and a unique perspective on the state of the American physician. Please talk about that a little and how that led to your involvement in American World Clinics.
Well, I've been working with physicians for almost a decade in terms of managing their careers, helping them effect career transitions. And what I found during that time was that physicians were very, very concerned about control and being able to, I'll say, treat their patients the way they felt they needed to be treated. They were looking for options or alternatives. Unfortunately, those options or alternatives didn't really exist in clinical practice, and so most of my clients ended up leaving clinical practice.
Based on your interaction with literally thousands of doctors, among them your clients, what do they describe as the major frustrations and challenges for physicians practicing in the U.S. today and in the near future? And how does AWC address those challenges?
Well, I can sum it up in one word: control. Physicians in the United States today don't feel that they are in control of their practices, don't feel that they're in control of their patients. As a matter of fact, they're so often told that the patients aren't theirs. The patient belongs to a health plan, or the patient belongs to some other corporate entity. And that's the opposite of what we will be offering at American World Clinics. American World Clinics is about putting highly skilled and qualified physicians back in control of their practice, how they practice, the procedures they choose and elect to do, and how they work with and manage their patients.
Put on your hospital administrator hat for a moment now. Do you see room for improvement in the relationship between physicians and hospitals? And if so, how do we make that happen?
Well, first I'll have to say that that's always a dangerous thing to have me do, but I'm a little leery of putting on the hospital administrator hat. But it's really far simpler than most people appreciate. It's a matter of respect. It's a matter of looking at physicians and the relationship between physicians and administrators as a collaborative partnership type of relationship. Today, in too many organizations, physicians are seen as commodities. They're interchangeable, they're replaceable. At American World Clinics, our physicians are our associates, they're our partners, they're our star players, and we need to treat them that way.
You've described and trademarked a concept called the physician-centered practice. What does it mean? How does it work? And are you bringing that to AWC?
Well, thanks for asking. I've taken a lot of flack over the years for the phrase physician-centered practice, because today in the healthcare world, everything is patient-centered. That's fine, and as my physician colleagues always tell me, the first thing we learn in medical school is that the patient is the center of our focus and our efforts. And so the physician-centered practice doesn't change that, but what it does is it realizes that if physicians aren't happy, if they don't feel valued, if they don't feel that they're being effective and able to manage their patients in an appropriate fashion, then that's going to reflect in patient care. It's going to reflect in attitudes. So the physician-centered practice model is one of saying, let's create as positive, as successful an environment as we can for our physicians, and expect that they will take that positive, effective attitude, and it will reflect in the quality of their patient care.
Bob, changing gears a little bit here, what do you see as some of the economic advantages of the AWC business model, and how will that impact the company's bottom line?
Well, economic advantages of this business model are pretty direct and straightforward. We are taking, at the very foundation of the project, first world medicine and placing it in the economy of a developing country. As sophisticated as Barbados is, the cost structure in Barbados is less than it is in the United States, less than it is in Canada, less than it is in the UK, and the rest of Western Europe. So we have that cost driver associated then with the quality of care, which providing good quality doesn't cost more, it's just different. So that cost structure, which is supported by a combination of the basic economics of Barbados, along with a very positive economic relationship we've been able to develop with the government of Barbados.
Is there a dominant brand in global healthcare delivery in 2011? And what's the opportunity here for AWC?
Well, that's an interesting question. There is really very little branding in healthcare. Is there a dominant brand in the world? No, there is not. There are certainly entities that are known worldwide, but they don't represent a global brand per se. And in other words, you can have a Cleveland Clinic, a Mayo, a Johns Hopkins, all very highly respected and known facilities throughout the world. But if you're living on the other side of the globe from North America and want to access those facilities, they don't have a local provider. They don't have a local shop. So there is no global brand in that context. That's our opportunity. We have looked strategically around the world, and we've said somewhere in 4 to 6 to 7 different locations, selected appropriately based on criteria similar to the selection of Barbados for the first American World Clinic, we can offer individuals the opportunity to access an American World Clinic within probably 1 to 3 hours airtime from their home and have that truly branded, predictable, high-quality experience.
Bob, do you see the changes in healthcare that we're currently experiencing here in the USA as relating to the AWC concept?
Well, the changes we're seeing in the U.S. right now, I would say they support the AWC concept. What's happening in the United States is there are several drivers. Some are economic, some are more, I'll say, structural or functional within the healthcare industry. Economically, physicians are making less and less money. That's surprising to a lot of people who think, well, don't doctors make a lot of money? Aren't they among the highest earners in the country? The reality is, and I've studied this over the years, physician salaries have effectively, or incomes, have effectively been flat for nearly 20 years. That's not what is happening in healthcare administration or other facets of the healthcare industry, insurance, for example. So that is causing physicians to look at other alternatives. Physicians are worried about their futures. That is causing physicians to say, if you can offer me a brighter future, then that's a plus. The other driver that is happening is more functional or structural, and that is through a variety of systems and mechanisms, physicians are being removed from literally making the direct patient care decisions about their patients. And as that happens, you are taking something that was at one time considered truly an inviolate relationship, the doctor-patient relationship. And now we have a doctor-patient, administrator, insurance provider, and probably 4 or 5 other entities plugged in there as well. At AWC Barbados, it's a return to that core nucleus of medicine. One doctor, one patient.
Bob, how can a physician participate with AWC without giving up their current practice?
Well, look at it as maybe an extended vacation. Working at AWC is something we have worked very hard to structure to make it easy and attractive for physicians to practice with us. Physicians need come to Barbados no more than a month a year to be considered active members of our medical staff. And that month can be divided into 2 separate segments so that they can have a working vacation. And one thing that's very important about the AWC model is a general surgeon, for example, in the United States practices a very broad range of procedures. A general surgeon at AWC will practice the key procedures that surgeon enjoys practicing. So a surgeon may come work with us, may practice 2-3 days a week, may practice 4 or 5 days a week, as long as they are practicing to a level that they're comfortable with, that provides them with the economics, along with the time management that they're looking for, then we can have a very positive relationship. At the same time, some physicians have said to me, well, does that mean I can't move there? Does that mean I can't practice 12 months out of the year? Well, absolutely you can. It is something that we're not going to tell you how to practice or how much to practice. We're going to ask you how you want to practice and how much you want to practice.
Bob, we're now in July 2011. Where are you with the project and what comes next?
Well, right now we just secured, I'll say, an official memorandum of understanding from the government of Barbados. The execution of that memorandum by the cabinet ministers of Barbados is effectively our green light to start our fundraising process, which we anticipate to be in the 6 to 9 month range. Once that's complete, it is groundbreaking and full steam ahead. We're hopeful that 18 to 24 months of construction period will allow us to clear the property and have our facility up, running, and open. So if we are effective with that, we will actually plan to start booking patients about 12 months before we open, which means within the next 18 months we could be scheduling procedures.
Very good. We've been chatting with American World Clinic's founder and president, Bob Priddy. Bob, we appreciate your time and insight and look forward to speaking with you again as the project moves forward.
Thanks. My pleasure for being here.
Thank you.